Hi, this is Mrs. Alexander, and I'm going to record your 232 Diabetic Emergency and your 233 Complications of Diabetes Frontload. Today we're going to be talking about some emergencies that happen with diabetics in their blood. Know that diabetes is a disease of the endocrine system, meaning that something's going wrong with those hormones. We've already talked about this in a previous unit. And so things that can cause an emergency for diabetics is whenever their insulin gets out of whack. So it's either too low or too high. We've talked a little bit about osmosis, and you know that there are two different environments called hypertonic and hypotonic that can represent too much or too less of solutes surrounding a cell. Let's apply that to Anna. When Anna's blood sugar gets too low because she's given herself insulin, she has to make sure that she levels it out by eating whatever carbohydrate she's already taken to effect. If her blood sugar gets too high because she hasn't injected with insulin, she can have a hypertonic attack. So those two incidents are what we're going to focus on for this lab. Here's a quick image that kind of shows what it looks like in a cell. I have an animal cell at the top, which would represent Anna's red blood cells, and I have plant cells on the bottom, which would represent the same kind of thing happening inside of a plant. Note that whenever your cells are maintaining homeostasis, they look like the first image. Water is entering and leaving the cell. However, if your bloodstream becomes very low in blood sugar, that means that there's more of a higher concentration of water in your blood system. Hypo means that the cells will swell like hippos and they can burst. And this can cause lightheadedness, dizziness, fainting. Same thing goes for hyperglycemia. Whenever the blood sugar is too high, it's concentrated with a lot of sugar in the bloodstream. And this can cause your cells to get shriveled up and shrink because they are shrinking because they're losing their water, because water always moves towards an area of higher concentration. So in this case, the water will leave the cells to try to level out or maintain homeostasis with the bloodstream. Notice the arrow pointing out of the cell where water's leaving it. So again, hypoglycemia is the same as hypotonic. That's whenever cells swell. Hyperglycemia is the same as hypertonic, and it's whenever cells shrink. The good news about these two types of diabetic emergencies is we have some devices that can help these patients. Glucose testing is the best way that we can do this. You notice in the bottom right-hand corner, you see something called a glucometer. It is a test strip that analyzes the sugar that's in the blood. So you have to prick yourself, put a little drop of blood onto the test strip, and the glucometer, the little meter, will tell you how much blood sugar is in that sample. Based on those results, diabetics can either give themselves insulin or understand how their diet is negatively affecting them and moderate their diet. Usually insulin is used for type 1 diabetics. Type 2 diabetics, sometimes they'll try insulin, but a lot of diet and exercise is important for type 2. If you notice the other image, you can see an insulin pump. Some type 1 diabetics will actually have a pump that is a needle and a little tube. They use a needle to insert the tube, and the tube stays connected to their little port in their body, and that port continuously gives them insulin. They can click the up and down buttons to give themselves more or less insulin, depending on what they're going to eat. An A1C test is what we refer to when a diabetic takes these results over a matter of a couple months, turns them into their doctor, and the doctor analyzes them. They can use to be diagnosed or to see how well you're managing your diabetes. There are a couple other names for it. So to diagnose and monitor your A1C levels, you will take your blood glucose levels over 2 to 3 months, give them to the doctor, and they'll look at what your baseline level of glucose is. Remember that hemoglobin is a red blood cell. It's a protein. It carries oxygen. And the higher your A1C level, that means that the poorer or the worse job you're doing at controlling your blood sugar. The doctor can tell if you're actually monitoring your diet and your exercise and using insulin correctly by looking at your A1C results. So it's important to turn in those numbers and to actually try your best at monitoring your blood sugar if you're diabetic. This is, again, a close-up of a glucometer. Type 1 diabetics will do this A1C test 3 to 4 times a year because they'll do it about every 3 months. Type 2, that's whenever they don't usually use insulin. They only do it about 2 times a year. And if someone with type 2, if the doctor's trying insulin at first, because remember it's insulin resistance, so they'll give them a manufactured version of insulin to see if it works. They go about the same as type 1 diabetics do, 3 to 4 times a year. Here's a little chart kind of showing you what an A1C level looks like. You'll need to know these percents for the test and for the quiz. A normal A1C level for someone who is not diabetic is around 4.5. If you go over that 4.5, then you're considered pre-diabetic. They really want diabetics under 7. If you're not controlling your diabetes, then you would be 8% or higher. Let me take a look at that. The highest the chart goes is a 14 on the A1C. The reason it tops out, and that's way high, double than where they want you, is because that's where you can go into a diabetic coma. We talked about diabetic ketoacidosis, which is how you can die from diabetes, but usually it starts out with a coma because of your A1C levels. So make sure you understand that chart. Under 7 is the goal. Around a 4, 4.5 is for normal non-diabetics. This A1C and the glucose testing can have decreased effectiveness. It can have inaccurate results if these little conditions apply. And that brings us to the end of our diabetes review. Let's talk about complications of diabetes. Earlier in the class, we talked about some symptoms. You saw a chart that looked like this, and we discussed all those symptoms. We're going to get further into depth on how those symptoms can turn into complications, things that are going wrong that you don't want to happen, such as having to have a leg amputated, losing your eyesight, getting different infections. Long-term effects in your heart can actually lead to heart disease, kidney failure, decreased sex drive, a disease called peripheral artery disease that has to do with the blood vessels in the leg, in the arms. Really bad dental hygiene, losing your teeth and your gums having diseases. Those are all different complications that you will get to investigate in this activity and in this class. We're not going to go into the PowerPoint. You can Google complications of diabetes on your own, but please understand that the symptoms do lead to worse complications. Last but not least, we're going to talk about some innovations. Innovations are different devices that scientists and inventors have created to help the life of a diabetic, to help increase their daily ability to do things just like you and I do. This ranges anything from glucose monitors, those pumps. They're trying to create an artificial pancreas. This can also be something as simple as a shoe and an insole inside of a shoe to help for diabetics. You will get assigned an innovation and look it up and get to share that with the class in this class. Please note that sometimes innovations don't work the way we think they do, especially medications. The way that we test for it and things like that can actually go wrong. And that's where we're going to focus on this little PowerPoint, is medicines that kind of backfire. A lot of times we don't know that there's going to be problems with innovations until we try them out. So it's not that doctors are ignorant or trying to hurt us. It's just we don't really know all the side effects before we try an innovation. Here's an early example. In the 19th century, it was a lower fever associated with childbirth when people were rich than poor. And that was because rich women received more care than poor women did. Something as simple as hand washing, right? Washing your hands. Before we knew that was such a big deal to prevent infection, that was one of those things that doctors who delivered babies wouldn't wash their hands, and then women would get diseases and contract different infections during childbirth and could lead to death. Two scientists worth talking about are Pasteur and Lister. You've probably heard of Listerine, like mouthwash, to helping get rid of the germs. Well, that's how I help remind myself what Lister's work focused on. He focused on sterilizing things and keeping them clean, and it was very, very important when it comes to keeping people from getting sepsis. Sepsis is a disease of your blood that a simple infection can cause your entire system to become diseased. And then Pasteur, he actually designed an experiment to be worth looking up that helped us determine how germs came about. Let's talk a little bit about radiation. Radiation was an invention that has been used in the 20th century. And before we knew that it actually could cause cancer, radiologists and scientists were actually putting their hands in the path of the radiation and causing themselves to get cancer while they were working with it. That's how the famous scientist Rosalind Franklin died, was of cancer because of her work with that photo 51 and x-rays and DNA refraction. So understand that sometimes new inventions can actually have effects to the scientist. There are a few more examples on this slide you can kind of read through. Thankfully now, x-rays are done with the lowest dose possible. We shield ourselves, we shield the patient except for the area that we're wanting to actually use radiation for, to take images such as x-rays. We can use radiation to kill cancer if we make it sure that it's only affecting the cells we want it to kill. Some other ways that diseases have been linked to medications, instead of just x-rays, but medications, are some examples in history. When nebulizers were used with certain chemicals inside of it for asthma patients, it was actually leading to death because of the chemicals that it contained besides just the medication. There was a hormone that women were given called DES, and they were given it to help different hormonal things, and it was actually leading to vaginal cancer, even though they were taking it for stuff to help. So they figured this out because there was a significant number of people reporting vaginal cancer, or women, and then they did a case study to find out what it was causing, and they realized that the hormone they were taking could actually affect the baby when it was inside their body too. So if they were taking the hormone while they were already pregnant, let's say to get pregnant, then it could actually cause cancer. Some over-the-counter drugs that you can just go and buy for headache or sore throat can actually have adverse effects as well. And when it comes to diabetes, the disease of your hormones not being regulated because of diabetes can actually have an effect just with over-the-counter drugs as well. So you have to be very careful if you have a disease or a sickness, and just how using over-the-counter drugs have an effect. Natural food supplements, when it comes to vitamins and minerals, if you're taking some sort of supplement, make sure you read the labels on your medications, because it can have an adverse effect. Even if you're one of those people that loves, let's say, grapefruit juice. I know grapefruit juice is one of those juices that can actually prevent medications from being absorbed correctly. And some medications say do not drink grapefruit juice or eat grapefruits while having this medicine. It's one of those weird little label things to read before you take any kind of over-the-counter or prescription medications for sicknesses or diseases. How doctors or physicians figure this out is they look at reviewed drug records, and they figure out from reporting what people are taking, and that's how they figure it out. It's all kind of luck of the draw. And nowadays we do case studies where people actually will go in to a blind case study and not know that they're taking a placebo or a fake pill, and then other people will get the real pill, and they'll document any and every side effect that they people have just to put it on the food label. We have something called the FDA, the Food Drug Administration, and they help make sure that our nation have strict laws to make sure that both over-the-counter and prescription drugs don't have adverse side effects, or at least have been tested enough to be used on a wide range of people. This is a whole really large area of study. If it interests you, you can go into it and help promote the drugs that are safe. Here's a list of our essential questions for 2.3. Please make sure you know the difference between those, and those are some of the topics. Remember, you should be able to answer these in order to be ready for the test.